Ladies and gentlemen, please welcome Dr. Georges C. Benjamin, APHA Executive Director.
Well, good afternoon, everyone. A little weak. We're going to try that one more time. Good afternoon, everyone. That's it. Thank you very, very much. Let me just welcome you here to our 134th Annual Convention. And I just want to introduce some folks. Let me just ask them to stand as I call out their categories. We have our Executive Board of the Public Health Association here. We have our Governing Council. If you folks would all please stand. Of course, our past presidents, APHA staff that are in the room, our affiliate presidents, our many international guests, our colleagues here of the Massachusetts Public Health Association. If you all would please stand and just give them a great round of applause. Thank you. I'd also like to certainly acknowledge my wife, Yvette Benjamin, who's up here in the front room. And of course, acknowledge all of our many sponsors. This is a wonderful meeting we're going to have for you, and I just look forward to this whole week. So those of you who got the video, why don't you just roll it for me?
Hello, my name is Miriam, and I am an immediate past president of the Latino Caucus for Public Health. I was first introduced to this gigantic conference in 1996 through my work with the Healthy People Initiative, so gracias ODPHP. As a young social worker, APHA was overwhelming, and yet I realized it was a tremendous training opportunity for the beginning of a public health career. 17 years later, at APHA, working with governing council, the sections, the boards, the committees, all the caucuses have really provided unique learning opportunities for professional growth and development, not only at these annual conferences, but also through the affiliate work. So gracias, APHA. You know this already because you are here, so gracias for being here. And excuse me, APHA is not only a professional network, but with time, it does become a network of friends, a network of scientific collaborators, and also an actual larger public health familia. So welcome, la familia. So let's continue forward doing good work con la comunidad, our healthy communities. Gracias.
Hello, my name is Liesl Neidiger, and I am the chair of the Student Assembly. I've been working in HIV prevention for about 4 years now. When I first started teaching HIV prevention to convicted drug users in 2009, I met Carlos. He was genuinely interested in learning more about STDs because Carlos and his girl wanted to keep himself and his girlfriend healthy. He told me how much he learned during my class, and it was just such an exciting moment for me. And I knew just at that time that I was in the right field. All of us in public health make a difference in people's lives every day. We don't always hear from folks like Carlos, but they are out there. I want to continue this work, and I am proud to join with APHA to make this happen.
Well, you know, I've practiced public health for 23 years, and I've had the honor of being APHA Executive Director for the past 10 years. I am motivated every day by members like this, those of you here today, the 500,000 people out there in the trenches running programs, conducting research, advocating for the public's health, and fulfilling the many other roles that improves the health in our communities. We all know that we work on behalf of a public that doesn't always understand or fully appreciate our contributions. Of course, that's really a sign of our success. When we do our best work, nothing bad happens. Our community stays safe and healthy, and like the Phantom or another invisible superhero, the public doesn't even know you're there. Thank you. You're the heart of APHA and the strength of the public health community. Thank you very much. Now, APHA has reinvented our field to meet the most pressing issues of our time for over 140 years. As we confront the rapidly changing health system, we recognize the many new challenges and opportunities. During this time of transition, we have been reaching out to more effectively engage you to better understand your needs and meet them. Now is the time to reposition APHA to achieve our mission. That mission is to improve the health of the public and achieve health equity for all. The annual meeting is always a revigorating time. We gather together each year to share ideas, to learn from each other, and to learn one-on-one, but it's not enough. If we're going to first ensure the right to health and health care, number two, build a sustainable public health infrastructure and capacity, and create health equity, then we need to build a proactive movement for health. Now, we're about 13,000 strong here today, and there are thousands of APHA members who couldn't join us, and there are more than 500,000 public health professionals around the country, and millions of people who care about the health of their families, their community, and our world. We must work together to create a more powerful voice to ensure our work is recognized and valued in the halls of government by opinion leaders around the country and by our neighbors, allies, and the public. It is only then, when we speak together with a clear and strong voice, that we will see the support for our programs and policies that we know will create health. As you saw in the video we just shared, APH is dedicated to building this movement. I hope you like our new logo, but it is much more than just an updated look. It starts with being firmly grounded in who we are and what values we all believe in. Talking and listening to you, our members, we have learned from you, and we understand what our core values are and what they are in terms of the foundation of this new movement. You know, we believe in community. Community is a place to solve problems, share new ideas, explore different perspectives, and come together as one. It is our community that gives our greater potential for impact. We believe in science and the evidence-based decision-making to ensure that our work addresses the issues and informs the solutions to make the difference we know is needed. It is our evidence-based approach that leads us to the best policies and best practices. We strongly believe in health equity. To address the underlying injustice that is so rampant in many of our communities, it is health equity that allows all people and all communities to be healthy. We believe in prevention and wellness, prevent disease and injury, mitigate the impact of disasters, and ensure healthy environments. It is prevention and wellness that leads to the healthy choice being the easy choice. And we believe in real progress, to hold ourselves accountable to forward movement in health. It is real progress that sometimes means just small steps, and sometimes means a leap forward, but it always means healthier communities. And we developed our new tagline to reflect these values and to act as our rallying cry. For science, because we will conduct and learn from cutting-edge research and promote the best practices. For action, because together our collective voice will drive changes in our health system and put innovative policies and programs into practice. And for health, because together we will improve the health of all people in all communities. APHA has been behind all the major public health advances for the past 140 years, but I gotta tell you, we're just getting started. Just getting started. Together, we will build a movement for public health. Today, we start the quest to be the healthiest nation in one generation. I ask you to join us.